Good afternoon, everyone. Thanks for joining us today. We'll get right into these data points. What I do want to preface today's town hall meeting with you with is the rate of growth in hospitalizations is not sustainable. And I'm sure there'll be some questions, and we'll talk about the data. No matter what you believe the severity of this virus is, the reality is we monitor positive cases, and whether those positive cases are known to us or not, if they materialize as hospitalizations, that is obviously the next indicator of the severity and the curve that we've talked all these months about. That is the curve we need to keep flat. As of today, and we've said this now over the last couple of weeks, so I'll reiterate it, the rate of growth in hospitalizations is alarming, and it is not sustainable. So let's jump right to the data points. 1,094 active cases. This is compared to our peak during the pandemic of 1,860. And again, there are two things you should know about that 1,094 positive cases. Number one, it doesn't represent everyone who has contracted the virus. It is simply those who have come forward and gone through testing, and we acknowledge that they've confirmed a positive case. It also is an indicator as to what comes next. We know that for every positive handful of cases, we know at some point we're going to see some growth in hospitalizations. 1,094 today, as referenced 2 weeks ago, 613 positive cases. So jumping, though, to hospitalizations, 1,094 current active cases, 93 hospitalizations, 93 current hospitalizations. And there are two things that I want you to be aware of when it comes to those hospitalizations. The reality is that it's not that these are more severe. In fact, the hospitals in our region feel comfortable. They know the playbook a little bit better, and they know obviously how a little bit better to manage the virus. And there are some therapies that have proven effective, at least in providing for individuals who come to the hospital that have tested positive. But as has been earlier and was earlier in the pandemic, those in the hospital today are generally a little bit older, and they, in this case now, stay a little bit longer. So the length of hospitalization for any individual is a little bit longer than we experienced early on in the pandemic. So what that means, of course, is that there's just a compounding effect. Now, it's not to suggest, and I really, neither am I suggesting, nor will I accept the argument that, simply that because most people will overcome this virus, it's not worthy of our acknowledgement, recognition, and the response. These individuals who are hospitalized need hospital care, and that rate of growth, that jump that we've seen now in the last 2 weeks, if that continues, as I said, that's just not sustainable. So looking back 2 weeks to today, active cases 2 weeks ago, 613, 1,094 today. That, again, is compared against our peak of 1,860. We will likely exceed that peak number within the next 4 weeks. That said, hospitalizations, if we look at that rate, hospitalizations 93 today, 39 2 weeks ago, and if my memory serves me well, 10 or 12 2 weeks prior to that. At our peak, we are at 108 hospital beds, or 108 individuals in the hospital. Now, the good news is that we do have a strong network with bed capacity, but this rate of growth at this point will likely put us over 200 hospitalizations within 2 to 3 weeks. So the rate of growth that we're seeing currently in both the confirmed positives and those that become hospitalized patients, again, not sustainable, ought to be of some concern to everyone, and will likely exceed, if we continue down this path, over 200 in 2 to 3 weeks. We have 425, 450 accessible beds in the system that serves Dutchess County. Now, the good news is that we're a part of two fairly strong networks of hospital care. The Westchester Medical Network, which oversees Mid-Hudson Regional, has a facility, a hospital that was activated in Ulster County that will act as sort of a regional location for individuals who have to be hospitalized, and they can come from any network, and Nuvance. And that network, which for Dutchess County is Vassar Medical and Northern Dutchess Hospital, along, though, with their other affiliated hospitals in Putnam County and Connecticut. So the infrastructure is there, but we've talked about this a little bit before. Not every bed is prepared for an infectious disease of this kind. So as those hospital numbers climb, hospitals will have to take precautions to be sure that there are beds and even wings available, because again, as soon as you start bringing an individual with an infectious disease into a bed that isn't necessarily outfitted for an infectious disease, they have to close off entire sections or wings in order to contain the virus. So this is not fear-mongering. We're not trying to alarm anyone. The rate of growth, however, is just not sustainable when it comes to those hospital numbers. So jumping back to the data, though, as we've said, 93 hospitalizations, 1,094 current active cases, 198 individuals have succumbed to the virus. That is now a dozen in as many days, sadly, dying to COVID-19. We continue, obviously, to monitor that. The regional positivity rate, and again, this is not the transmission rate. This is the number of positives divided by the number of tests, is 6.2% in the Mid-Hudson region. That's 6.2%. As of December the 8th, Dutchess County's 7-day rolling average is 5.4%. We've consistently held a little bit behind or toward the lower end, but of course that jumps on any given day. Dutchess is yesterday 5.9, but our rolling average 5.4%. Orange County 7.9 rolling average. Putnam 8.2 rolling average. Rockland 5.8 rolling average. Sullivan 4.4. Ulster 5.3. And Westchester 6.3% average. Now, we're seeing positivity rate higher further west in both New York and as you get into the Midwestern states and sort of Middle America. But we are seeing, again, in certain testing facilities, and we monitor this to the best of our ability, we are seeing much higher rates of positivity. Now, that gets synthesized when you consider all of the tests being conducted, but where we know and are monitoring, we expect that rate to continue to climb, and that is something that we need to certainly be aware of and take steps to prevent. And again, those protocols that we've talked about all along are steps that make sense. Watch your own personal hygiene, certainly. Make sure that if you're not feeling well, I know that it's tough. I know that you have to go off to work. I know the kids need to go to school. But if you're experiencing symptoms or you're not feeling well, really important that you contact your physician, not report to work, not go off to school, and take really care of yourself. Obviously, those social and physical distancing that we've all talked about, keeping social gatherings and sort of interactions to small groups, that are sort of following those same protocols and safety measures that we've all talked about, and wearing a mask. All of these things combine as mitigation steps. They don't stop the spread of the virus, but they slow it and can be of benefit to you and the health of those you care about. So those are the data points. If you have a question, write it in the comments section below the live feed. I'm happy to get to as many as we can. Victor, I kind of answered your question. How concerned should we be about hospital bed capacity? We should be concerned. As I said, the pace of growth now, knowing that we came out of Thanksgiving and we're still seeing positive cases as it relates to that social interaction. And, we get it, right? People are more casual when you're around family. Some people, just didn't want to adhere to some of those basic expectations. Some are just angry and don't want to participate and don't want to take those steps at all. I understand these emotions, but we do know that the interactions and the activity that occurred over Thanksgiving led to more cases. We're now approaching Hanukkah, and for those who celebrate, we hope that you enjoy a small and virtual Hanukkah celebration beginning Thursday this week, followed by then Christmas and New Year. We just know that the social interaction, the casual interaction that everyone is going to have is going to produce cases. Now, we can take steps to limit that by following those protocols, but right now the rate of growth of hospitalization is is definitely concerning and ought to be of significant concern to all of us. Now, we're working together with our hospitals. We'll get to some identified points that I'll mention, but they feel more confident today than they did in April. But that said, the rate of growth is just something that needs to be top of mind. Teresa, when will pending addresses be updated? Let's pull up do we have the municipal? Let's show the dashboard again. For those of you who go to the dashboard, you can follow the municipal cases. We're at a point now today, similar to what we said months ago. You should assume that either you or someone very close to you has contracted COVID-19. I know that there is a need for many people to say, well, how many in my neighborhood or how many in my community? We try to give you that information. I'll talk about the pending cases in a minute, but we try to give you that information based on municipality. But the assumption is that this is a slice of those who have contracted the virus, and you should assume that we're either carrying it or someone we know is. And if we act in that way, we can slow the spread of the virus and contain those cases and really protect our health and the health of others. Now, the pending, every day we're getting cases that come in, positive cases. So when you test with a lab, that case, when you test positive, goes into the state database. That state database is not perfect. In some cases, you could go to a test site in Bear Mountain and be a Rockland resident, and by accident it's classified as a Dutchess resident. You could be a Dutchess resident and classified someplace else. You could be testing positive in a location, for instance, a state prison or a large testing pool, and all of a sudden all this information gets dumped into the state database. It's up to county employees, you met a few of them, or epidemiologists and others over these last few months, who go through case by case by case. Now, we have two choices. We could guess and be inaccurate, which we don't want to be, or be sure that information is accurate. And it does take time in many cases to go through those numbers. So right now we are showing, I think, 621 active pending address cases. Every day that's a different number. So every day there's cases coming in that need to be verified, and every day we're verifying those. So it's going to go up, it's going to go down, and the goal here is to try to get that responded to as quickly as possible. So it's not that there's 620 that are just statically sitting there. Every day they're verifying. We will and are going through this pretty aggressively to keep the number as low as possible. But to be very candid, the number of cases coming through the system, being added to the database, being flooded through the labs, is just a lot. It's just a lot of data points to verify. And all of the things that we talk about, address, whether one's hospitalized or not, all those are data points that we have to verify to be sure they're accurate. And so the approach we've taken is to classify them as pending and then move them into the right municipality based on confirmed data. That will go down. It will go down. It's just, as I said, not a static number. They come in and out each day. Kate, should we be concerned for another shutdown? So I'll be very candid. I don't believe the governor of the state of New York wants to do that. And what I mean by that is that everyone understands the overwhelming hardship that will place on families who've got to deal with paying bills and dealing with daycare provision in schools. It certainly also has its own impacts on mental health, mental wellness, issues regarding domestic violence and substance use. And I think what the governor's hoping to achieve, and again, you've heard me, take issue and be somewhat supportive of these of certain steps. I think the goal here is to really encourage that we focus on the mitigation steps that work to slow the spread. At the same time, the state is working aggressively with the federal government and county governments to move toward vaccine distribution and vaccinations. And they're hoping that light, we're approaching the light at the end of the tunnel in a timely enough fashion that we don't have to take additional precautions. Now, that said, there are, as we've talked about before, these microcluster designations. If there's an area that flares up, it is likely there would be restrictions. But right now, I don't believe it's the desire, although, again, the concern is hospitalizations and slowing the rate of growth in those hospitalizations. So right now, not something that's been discussed in any of the calls, and certainly not something that's been discussed among leaders at the state and county level, but it is something that obviously we're all concerned about and we want to keep an eye open to. Michelle, we are over the 10-day average. Are we going to require testing schools? Michelle, great question, because it's not that easy. I wish it was. Let's pull up the microcluster guidance. Number one, whether or not the county as a whole is over the 10-day average is not material to the cluster guidance. The cluster guidance is very specific to a geographic area, and the state determines that geographic area. We don't. It could be a zip code, could be a whole municipality, it could be a census block. And the two indicators are, first, in order to go to yellow, over 3% for 10 days and 12 or more new daily cases per 100,000 on a 7-day rolling average. So, I'll tell you that, we've got to be approaching it, but we don't, Dutchess County governments don't have access to all of these data points, or those two data points in particular. If we don't know how they're measuring, census block, municipality, or zip code, we don't know necessarily what we're measuring against, right? So currently, the state is not advising us of a potential microcluster, so no testing requirements or alteration in schooling. But again, we watch the data. We clearly are on the verge of one designation, and that will happen at the state level. Now, based on what's occurred in other counties, we expect that we would know within 72 hours of such a designation. We would discuss that in detail with the state and the municipality that'd be impacted, and we'd be prepared to take steps. Now, the good news is when it comes to schools, a couple things. One, the restrictions or the requirements to stay open have altered. You want to pull up those colors so we have those? They've altered a bit. So in yellow, schools can remain open if we conduct a biweekly testing of 20% of in-person students and staff. If you move to orange, they're not required to close if 20% in-person students and staff are tested over the month following the designation. So you could spread that out to 10% biweekly. And in the red zone, it's 30% in-person testing, and then you can see the designation there. We do have the infrastructure to assist with testing, but it really is dependent on how many clusters and how many schools, right? So we did assemble a team both internally to county government. We have the staffing resources. We've secured access to testing. We've worked with our test providers, organizations like our hospitals, New Vance and Westchester Medical, Mid-Hudson Regional, and Vassar in particular, and our care providers like Pulse MD and others. We have the capacity to provide the testing to meet the requirements. But step one is if a school falls within one of these zones, the school itself has to decide if they want to stay open. And they may, through conversation with staff and students, they may decide not to, in which case there's no testing that's going to occur. But if they choose to, again, depending on how many clusters we're looking at, we are prepared to provide assistance with testing. That is the requirement of the district to work in cooperation with the county, but we'll work together to achieve those goals. Again, assuming that we're not flooded by the number of clusters. Kim, are we expecting to open another drive-through test site? Great question. Those test sites are determined by the state of New York. We've requested another one again. I'll mention that one of the concerns we have is adequate access to testing, while the hospitals in particular are also focused on conducting elective procedures, which there was a surge after closure and pause of those procedures. There was a surge. And at the same time preparing for vaccine and vaccine distribution, and I'll get to that. But we've asked the state for such a drive-through site. I will tell you that there are not that many. Testing is a problem nationwide. Accessing adequate testing is a problem nationwide. If you have a question regarding testing, please visit duchessny.gov /coronavirus testing. If you go to duchessny.gov and tab on or click on the COVID tab, you'll be able to click directly into the testing category. We'll give you the locations of testing options. Again, they're all slightly different. Some come with quicker access depending on their capacity, but you'll be aware of that. Jen, Wappingers has been 5.8% average. Why are we not closed? What zone are we? Jen, good question. When you say Wappingers has been at 5.8, I don't know that we've provided a town percentage. The school dashboard is showing 5.8. So again, the easy answer to your question is what zone are we? To what zone are we is whatever zone the state says we're in. So on any given day, again, they could be measuring the zip code, the census block, the municipality. It is not, however, the school district. So what they've said is census block, municipality, or zip code. And so far, state is not classifying any area in Dutchess County as a microcluster zone. So there is no movement in that regard yet. Wendy, are we expecting phase rollback, reducing capacity? Good question. The state has not done that. What the state has done is use that yellow, orange, and red framework. Cases start to rise. What the governor has said is that they'll slow down if, in particular, if hospitalizations exceed or are projected to exceed 90% capacity over the next 3 weeks. The state is sort of localizing certain restrictions, but they're not using the phased approach any longer, and they're not currently, and they're not necessarily rolling back regions or even whole counties. They're looking at areas within those counties. And again, there's some practicality to that. There's also some challenge to that. I mean, if you were to roll back certain restrictions in the 12601 zip code, you wouldn't protect people from driving in and out of the 12602 zip code. So we work with the state to try to identify what the right approach is, but there has not been any discussion about reestablishing those phases. It'll likely be a focus on some of the activities that we know are higher risk, and what the state's done is use that yellow, orange, red framework as the sort of the measurement tool. Walter, why is there discrepancy between the state and county numbers? We're 24 hours after the state. So if you look at the state's numbers on any given day, our numbers are verified and then updated over the next 24 hours. On a given day, it's likely one day out. But keep in mind that those are the state numbers. The numbers we show, we merged our numbers early on midway through the pandemic. We use the state data, but again, the state data isn't always perfect. Remember, they're getting it from the labs directly, and then we, county governments, have to go through and verify a lot of those data points. And so what you'll find is on, let's say today is Wednesday, on Monday the state releases their number. On Tuesday, over the course, so usually that's been late in the day on Monday. I think now it's like 3 or 4 o'clock p.m. The state is releasing their data points. So let's say that's late on a Monday. All of Tuesday we're updating, and on Wednesday you'll get the county's dashboard updated to reflect Monday's state numbers. As we've corrected the state's data points, the state number will be updated in the next day. So it's not. I don't mean to make light of it, but it's just a process that the data is submitted to the state. The counties verify that data, and we do over the 24-hour period, and then you'll see our numbers updated, and then subsequent to that, the state numbers are corrected in essence, although it's merged in with all the new cases. So we're always a day after the state numbers. Sarah, are elective surgeries going to stop? The short answer is not yet. What has occurred so for Erie County, they were at such a rate of growth in hospitalizations that the state did restrict and pause elective procedures as of last Friday. What the governor has said is if we project the hospitalizations to rise to 90% of our capacity within the next 3 weeks, which we are not on target for, but we are moving far too fast with hospitalizations, that there would be restrictions. In the meantime, there is not currently a restriction or an expected restriction on elective procedures. Okay, let's jump through some additional points. Just a reminder, if you have a question, write it in the comments section below. You likely know that the CDC updated its guidance regarding quarantine requirements and testing out, if you will. CDC updated guidance recently for close contacts to be able to test out if asymptomatic. Now, the state has not changed that requirement. So currently, New York State, close contacts, even with a negative test, must still quarantine for the period that has been instructed by the health department. So no change, even though the CDC has made that change. What happens and has consistently happened, and understand, the CDC makes a recommendation. They're not regulatory in that sense at the local level. They make the recommendation. The state's departments of health review those and then decide how they want to apply those recommendations. In New York, the quarantine requirement has not yet changed. It's possible it could, but it has not yet changed. As a way of, sorry, am I going too fast? Oh, good. Just as a way of keeping folks up to date, we are hiring. The County Department of Behavioral and Community Health is adding data entry, call takers, and rapid testing, part-time temporary staff. That comes with as much as up to 30 hours a week of work. Candidates need to be must at least have a high school diploma or a GED. These are temporary positions that we are filling. If you're interested, you should reach out to us. And in particular, If you have experience as an EMT, a paramedic, an LPN, a CNA, an RN, or some training in first aid and or medical training, in particular for rapid testing assistance, we're calling on you. So reach out to the county's, go to the county's website, dutchessny.gov. You'll see some information regarding that. We are hiring temporary help to assist with testing, tracing, and call taking, and data entry. Please reach out to us, in particular if you have any medical or healthcare background. Very, very helpful to us. But you need a high school diploma and or a GED. Good. So we are monitoring what the state has said. The governor has updated some restrictions, as I mentioned. If hospitalization rates do not stabilize within 5 days, the state is considering indoor dining restrictions along with gyms, along with hospital capacity. But that said, gyms, barbershops, salons will not be required to close. The state has acknowledged what I think we've seen before, which is we're not seeing the spread of the virus in those formal settings. Gyms, barbershops, salons, the steps that have been taken, and people are being safe, and we're not seeing that transmission. But again, if hospitalization rates don't start to stabilize, the state is considering some restrictions on indoor dining. But again, that is a fluid conversation, and we'll be monitoring that with the state. Now, additionally, hospitals are being required to identify bed expansion, 25% expansion of bed capacity. Our hospitals are able to meet that expectation and are moving and have moved forward with that. So let's talk a little bit about vaccines and vaccination. As I do that, we'll take a couple more questions. Do municipality numbers include state facilities? Yes, they do, when the state tells us. So like a state prison, if there are inmates that reside, obviously they reside in the prison, not staff, but if they reside there, they're counted. But again, the state does sort of batch testing. So unlike you or I might decide to go to test tomorrow, right? An inmate's not getting tested every couple of days. They'll do these batch tests, meaning a bulk of them in one location. And as they're added, if they are residing in a state facility, in a municipality, yes, that is included in the municipality. Justin, is there a number before more rules on gatherings will be put in place? Well, those are the yellow, orange, and red that we talked about. So it's 3, 5, 7%. Did I get that right? Make sure I do. Pull up the color code there. Microclusters. Here they are. 3, 4, and 5%. Sorry, 3, 4, 5%. Those are the triggers when matched with 10-day average of 12 or more new cases, and the restrictions for sort of those congregate settings, meaning where people gather, are in the color code, which we'll bring up now on gatherings, just as a reference, so you have that. These are the gathering limitations that the state has identified. Currently, we're at 50% for houses worship, for instance, but orange would be 33%, and then red 25%. And again, the state's expectation is that those kinds of settings will all follow the same kinds of restrictions. Lisa, I think that kind of answered your question too. What are the restrictions coming to restaurants? We don't expect, again, you have to be in one of these identified clusters. Currently, no additional restrictions countywide, no regional restrictions, but the state is monitoring the potential for these individual cases. Linda, does the county count multiple positive tests per person or just once? Well, if you take a rapid test positive, and somehow you take several diagnostic tests and test positive, it's one person, one positive. So, but again, in theory, you've taken the test, you've tested positive, you're quarantined, and you're in the system as a single positive test. So they're not multiplied in any particular way. Mary Ellen, does the county have capacity for school testing requirements? The short answer, as I said, is yes. Again, it really depends on how many schools. I mean, as I said, in Orange County, for instance, they had several cluster zones. Some of the districts didn't want to conduct the testing, therefore there was no testing conducted. Therefore, they chose not to remain open. Some districts did, and testing was accomplished, and that's occurred in other counties. In some counties, some districts in Onondaga County, same thing. Some wanted to be tested, and they went through the process. Some didn't. That's a decision the school makes. The other is the state order is the schools are responsible for testing. I mean, it's very clear. Schools are responsible for managing that testing, however, to do it in coordination with counties. So county governments have been working to meet that need. As I said, we have a staff team dedicated to testing. We have access to testing machines, the machinery and the test kits. But again, it really depends on the school. There are probably 125 graduates of the Red Hook High School. There are 125 kids on a bus in Wappinger Central School, so it's a big bus. So it depends on the number of clusters and the districts, but yes, we believe that we are in a position to work with the school districts to meet the testing requirements should they wish to test. Some may choose not to, and that is up to them. Some families may not want to be part of it, and if you're not going to get to the 20%, it does not make sense to conduct the testing because otherwise it would be a waste of everyone's time and resources. Donna, are courts following order to push cases back to January 1? Have evictions been suspended past January 1? I don't think they've been suspended past January 1, but those restrictions remain in effect. The evictions, but they're specific to certain kinds of cases. But again, evictions frozen, and courts are on still limited scheduling. So if you have a specific case, you need to obviously speak to your counsel or to the courts themselves, but evictions still suspended, and that is by the governor's order. Don, how is the county doing financially? Well, we could be better and we could be worse. So right now we are tracking in sales tax receipts below what we budgeted, below what we will have received last year, but it is currently manageable. And as you likely know, last week the Dutchess County Legislature voted to adopt the 2021 budget. Which does shrink the size of county government. We're saving significantly on spending. It's necessary. I do love people suggesting we should spend more money. I'm more than happy to consider it if we have more money to spend to focus on some of those priority areas. But this budget is consistent. We've said this. It meets the challenge. We are able to provide our services. They're going to staff and department heads and others are digging deep this year. We expect to be able to meet the expectation of residents. We're not planning for, nor is there a reduction in core services and the delivery of those services, but we are shrinking the scope of county government in order to meet the current financial need. And so we're doing that without raising taxes. We did that without laying off employees, and we're doing it by maintaining those services. So far, managing relatively well. We'll get back to budget in a minute. Vaccines and vaccination. Let's talk a little bit about this. County governments are playing a role in vaccine distribution and vaccination. If you followed the news, you'll have seen that Great Britain and Canada have begun vaccines, in particular among frontline workers and nursing home or older citizens. That is the priority and basic priority of vaccination in this country. We expect on or about December the 15th that the Pfizer doses will be distributed for the first round of vaccines. Now, vaccination is orderly. The federal government, through Operation Warp Speed, is working directly with state governments and county governments. Yesterday, the New York State counties were represented by the Chautauqua County executive at a summit on vaccine distribution at the White House. Ryan McMahon, the Onondaga County executive, P.J. Wendell, Chautauqua County executive, and I represent the New York State counties on and as part of the White House vaccine coordination. PJ represented our group, and we are working with the state leadership. And let's be clear, there is no delay in New York accessing vaccinations. I know that the governor and president engaged in conversation back and forth, which at times I would suggest was not terribly productive for anybody. But that is proceeding. Vaccine distribution is proceeding. We expect that hospitals will act as the hub, meaning sort of the centralized location, in particular during the first round of vaccines. Vaccination will be focused principally on frontline healthcare workers first, nursing home resident staff, and those sort of congregate settings for care providers and patients next. So starting in December, this month, you and I will not, unless you're a healthcare worker, you and I are not going to have access to a vaccine. Phase 2, which is likely to occur at some point in January, will likely be first responders, emergency care providers, and others. We're asking for direct care staff for those with intellectual and developmental disabilities and those with disabilities to be prioritized in that category of vaccination for those who wish to be vaccinated, take part in the vaccines. And then the third phase, which is likely to be later in the spring, will be open more broadly to the public. We're going to be talking a lot more over these next several weeks with you about vaccines, about the science behind them, and the efficacy and the safety of those. Again, in New York, and the governor has said this, vaccination will be by choice. But we have confidence in the science, and we have confidence in the effectiveness of the vaccines, and we'll keep you posted. We're also, just so you know, we'll be talking a little bit with hospitals. We'll have some of our hospital staff and administration here at some of the town halls to talk a little bit about the vaccines and take questions. But let's be clear again. This is a several-month process, starting with categories of people. Those priority groupings, not up to Dutchess County. I don't get to decide. Dr. Wythian doesn't get to decide. In every case, this will be determined by a collaboration between the federal government and state governments. And again, first is healthcare providers, followed by emergency responders, nursing homes, etc. Healthcare workers, nursing homes residents, and then emergency responders. And again, we hope that direct care staff is included in this top priority. And then as we get into springtime, it'll be more open for the public. We are convening a cooperative of community leaders and interested stakeholders, meaning individuals who are trusted in the community. We're asking Kathy Tetmeyer, who is the deputy or assistant commissioner of the Department of Behavioral and Community Health. She's going to take on the role of coordinating that vaccine and vaccination education and outreach. We'll be doing that in concert with our colleagues in the region. So Dutchess, Ulster, Orange, Putnam will be working together to communicate, again, using the hospital and healthcare community to explain the science behind the vaccines. We are, as I said, Kathy will be convening a collaborative that we're establishing of community stakeholders, church leaders, community organizations, others, to educate and inform and put them in a position of being able to be informative and helpful to you in responding to concerns and really establishing our level of confidence in the vaccine. And again, by choice, we're hopeful that we will have a robust effort to inform, educate, and then hopefully participate in vaccine and vaccinations. Is the county going against the court order on church capacity? Frank, the county doesn't have to do that because the United States Supreme Court ruled. This is two things you should know. Excuse me one second. So what the U.S. Supreme Court decided in the Brooklyn case, which is specific to the parties in the Brooklyn case, so the decision was that the state could not impose restrictions, capacity restrictions on houses of worship in the Brooklyn zone that were greater or stricter than similar facilities. So just as an example, although not the one that is in the zone, but if you limited sort of movie theaters to 25% or 50, let's say 50%, you couldn't limit houses of worship to 25%. So our interpretation is that while that court decision is specific to Brooklyn, that it applies regardless when a zone is classified. So our understanding, and again, it's unique to that specific zone, but we believe that anyone who would bring a similar action in any other zone that ultimately got to the United States Supreme Court will be ruled on in the same way. If a zone is identified and there are restrictions, that those restrictions have to be universally applied. It's not that you can't have the capacity restrictions on a church or house of worship. What the Supreme Court said was you can't have a more strict set of requirements for a house of worship than you could for someplace else, because we are constitutionally protected and our right to expression of our faith and religious exercise is protected by the Constitution. So All that said, we will apply the expectation that the Supreme Court has, which is, again, within a zone, there can be restrictions if the state imposes them, but those restrictions have to be universally applied, not greater or more stringent for a house of worship. That is the way it is. But in the meantime, as I said, we're not on the verge of any such designation. We have to be on the verge of some designation, but we are not aware of any as of yet. So that is, we honor, and I've said this consistently. This is we do have constitutional protections. Those protections are to be honored even in times of emergency. And what the Supreme Court did say was that restrictions could not be greater in a house of worship than other like activities, and therefore that's how we would apply. And again, we don't get to make the final. We don't get to necessarily set the standard. That's the state. But our position is, as is anybody and all the counties that I can point to, that the restrictions need to be uniformly applied, not specific or more stringent for a house of worship, which is what the Supreme Court ruled. Sorry, I didn't want that to be such a long answer, but sadly, it is. Kimberly, will the vaccine be mandatory for healthcare workers? Right now it is not mandatory. But we did have the question as to whether or not in a healthcare setting the employer could require it. So we'll get you that answer for next week. But vaccination will begin with healthcare workers, and I don't know if it is mandated by the employer or whether or not that can be. So I'm not going to guess at that answer. If I find out while we're watching, and I'm sure somebody's typing the answer as we speak, but nevertheless, if we find out while we're live, I'll get you that update. But again, right now, what the state has said, generally speaking, this is by choice. The governor has said mandating the vaccine is not a good idea. His paraphrased words, and I agree with him. Could school nurses be added to the priority list for vaccination? I'm not sure. That's a fine question. I think part of this is if schools are not necessarily open or there's restrictions or could be restrictions, that there may be some desire not to have that entirely have school nurses in the healthcare, but I don't get to make that decision. But we will ask that question as well. Parker, are schools mandating masks during lunchtime? Well, again, the rules are set by the schools, but I think in most cases, students are required to wear masks unless, and again, lunchtime should be physically distanced, unless should be masked when they're in congregate settings. So sitting at a table, eating at a distance from someone, a mask is not required necessarily, but obviously socializing, getting up and about it is, and that is up to those rules are established by the school district. I will say that we have had a lesser rate of transmission of the virus in school settings than in other settings. Just to update you, employers currently can mandate employees get vaccinated. So the employer, and you should check with your employer, currently the law, the order provides that an employer can mandate employees get vaccinated in order to report for work. So you may have a healthcare provider who is going to mandate that as a requirement. Again, I'm sure there were plenty of opinions, just reporting what we what we know. That said, we've talked a lot about the rate of transmission. Remember, we are seeing the spread of the virus in casual settings. So we are encouraging you over the holidays in particular to try to keep it small. Small social gatherings, physical distancing, and wearing a mask all work. If you feel not well, or you have particular health concerns, or you feel like you're symptomatic, you should contact your physician. Don't go to work. Don't go to those social settings. Don't go off to school. And obviously maintain that personal hygiene. All very important. So I do want to encourage you, if you do test positive, please visit the duchessny.gov website. If you test positive, important, visit duchessny.gov. Begin to isolate immediately. I will tell you that, and I don't know why, but some testing authorities aren't giving you this information. If you test positive, you have to isolate. And you want to isolate for your health and the health of others. Don't wait for that. At the same time, stay home. If you have an urgent medical need, obviously you want to contact your physician or dial 911 if it is an emergency. Notify those close contacts that you've had some contact with. So as an example, if by chance I tested positive, In my home are my children, my wife, and my parents, who have been living with us for several weeks now. I'm not asking for any sympathy. It's very nice that they're living with us. But if I were to test positive, I would tell everyone in that household, my wife, my children, my parents, that they too must isolate. Those would be individuals I have close contact with. It is likely that if I tested positive, the ladies that you see to my right would likely be among those people who are close contacts, right? Right. Yes. And we wouldn't all isolate together, but we would isolate. So again, what we're saying is a reminder, no matter what you have heard otherwise, and if you haven't been told if you test positive these instructions, that's the expectation, that if you test positive, you quarantine and isolate, you notify those individuals that you had come into close contact with, that they should isolate themselves, and they ought to monitor their health and ultimately be tested. So close contacts that were within 6 feet for 10 minutes or more in a or longer in a 24-hour period, those are considered close contacts. They ought to be isolating as well. And then the restrictions, the isolation requirements are a little bit different in every situation. Maureen, can all employers mandate the vaccine or just healthcare? The way we understand the rule, and Sean is going to make sure I don't get it wrong, the way we understand the rule currently is an employer can mandate vaccination. We will confirm that for you, and we will make sure that we have a section of either some order or rule that we could point to. So we'll make sure that you have that. But Maureen, great question, and I don't want to misspeak, but I believe the employer can require it. So those are the steps on quarantine, etc. We've talked a lot about the clusters, the zones, the colors. You have a little bit of that. And I do want to get through a couple other items just so you're aware. Let's just point to the shared services plan. That is this today a public hearing too? So as part of our requirement in the county, and this is all across the state of New York, the state is requiring counties to organize these shared services plans. We've been doing these for several years now. We are participating in the final 3 public hearings of that shared services plan. If you have a question regarding it, we're estimating some projects, including upgrades to the village of Wappingers, town of Wappinger, town of Poughkeepsie, Tri-Muni sewer facility, estimated savings $133,000. We also put forward a proposal that we're working on with police agencies as part of our police and law enforcement reform efforts. You'll see all of the participating agencies to purchase body cameras in 2021. So the goal will be to coordinate that purchase of body cameras, to work with those agencies that want to participate, and any municipality that wants to participate in a shared purchase and lease arrangement, assuming lease is the right option. We would generate the savings, and that is included in this shared services plan. Do want to thank those police agencies. We'll be talking in the next couple of weeks about our law enforcement reform plan. A great response from law enforcement officials across the county, police agencies, municipal leaders, and other stakeholders and activists. Very productive effort. But one of the priorities has been to make sure that every agency that wants to, and again, we think this is good practice. Police officers prefer to have the cameras, as do others. So the goal here would be a joint and consolidated purchase and lease arrangement for body cameras for police agencies, and then those agencies that participate together would enjoy some savings because of the ability to purchase in a group effort. So if you have questions regarding that, ask them today. Feel free. Municipalities have to sign off on the plan, and then we submit that to the state of New York. And at some point, sometime, the state may or may not provide us some assistance, financial assistance. So this particular plan is 2 projects, 6 towns, 6 villages, and 2 cities participating in this particular shared services plan. I mentioned the budget. The county legislature last week did approve this county's our 2021 budget. We thought today would be a good moment to talk a little bit about the budget, but also, as I'm required by the county's operating procedures and the charter, I am to consider and ultimately sign the budget. So the 2021 budget, as I said, shrinks county spending. It's out of necessity. We have less revenue coming in, greater demand that is on us to provide for and respond to this pandemic. We shrink the county's workforce without layoffs. In fact, we're able to and secured positions for pandemic response and other core responsibilities. No diminishment of those services, nor any reduction in our ability to respond to those needs. We also are prepared that if the federal government finally comes through with state and local aid, and it looks like that's going to happen, we are prepared to be able to replenish some of those vacant positions that we're holding vacant. We didn't eliminate them. We're holding some of those vacant as we work toward a new economic recovery, new revenue, and potentially the federal government coming forward finally with much needed assistance. We have reduced spending, and as I said, we've been able to hold the line on taxes. No tax increase, no fee increase. In fact, a modest property tax decrease in the 2021 budget. I want to thank my colleagues in the county legislature. This is stamped approved and then signed as I need to. So the budget is approved and will be returned to the county legislature for implementation in 2021. I want to thank Chairman Greg Pulver, Legislator Will Truitt, who serves as the budget chair, or chair of the budget committee, and my colleagues for their diligent effort to review the 2021 budget. I want to thank the majority members who voted and Legislator Randy Johnson, who did vote in favor of the budget. Grateful for that support, and we will move forward in a very compassionate and aggressive way to confront the needs facing Dutchess County residents next year. So budget is signed and returned. It will be returned to the county legislature for implementation. This is a $502 million spending plan that, as I said, reduces county spending, but also holds the line on taxes and does not eliminate core functions nor lay off any county employee. If you have questions, write them. Good. These are great questions. If you have any questions, write them down in the comment section below the live feed, and we'll get to them just in 1 minute. I do want to mention that the Harlan Valley Rail Trail is open, and it is gorgeous. Great project, a really super investment in eastern Dutchess County. Harlan Valley Rail Trail, our oldest rail trail, is now complete. We have connected Dutchess County and the rail trail from the Wassaic train station in Amenia to Copake Falls in the area of the Taconic State Park in Columbia County. And I know it's a little chilly out, but take advantage of it. Be outside as best you can, but please do visit the Harlan Valley Rail Trail. This connection is just amazing. Next spring, we'll do a more formal reopening, but please, I hope you are able to take advantage of the rail trail. We've got some exciting stuff going on this winter. We'll be talking about a little cross-country skiing activities and other activities at county parks we'll talk about. But please, Wassaic to Copake, the Harlan Valley Rail Trail is open, and we welcome you to take part in that. On Sunday, December 13th, from 3 to 7 p.m., we invite you to Dutchess Stadium. The Hudson Valley Renegades are organizing a tree lighting and holiday craft fair, all following the COVID-19 protocols. So you can visit Dutchess Stadium between 3 and 7 p.m. on Sunday, December 13th, lighting I think it's trees, actually, but nevertheless, there'll be tree lighting at the stadium. Another opportunity to drive through to kind of see some of that activity and, of course, celebrate the holidays. So that is the 13th. Now, on the every weekend, right? So every weekend for December, does it go on forever? So during December, Saturdays and Sundays, 3 to 5 p.m., stroll in BOWDOIN Park, Winter's Prelude, Melody at Dusk. Our Parks Division, led by Sandy Washburn, doing a great job, and the park staff. This is just a great opportunity. Some music played from the chapel at BOWDOIN Park, and we encourage you to stroll around this beautiful county facility, great park in the town of Poughkeepsie, town of Wappinger, and enjoy a little bit of evening music as you're walking through the trails and around BOWDOIN Park. Also want to invite you to participate in the same weekends, in partnership with the Adrian's Library. Is that right? the Poughkeepsie Library. Thank you. One of them. The Poughkeepsie Library District is joining us at Bowdoin Park both weekends. This weekend, from 3 to 5 p.m., Bowdoin Park Story Walk, the book by Ezra Jack Keats, The Snowy Day. If you're familiar with that book, I think just about every kindergartner and preschooler knows this book. I've read it many times with my two youngest sons now, Eli and Theo. But nevertheless, The Snowy Day, just a great walk through Bowdoin Park, and you'll see signage and some details there. So please take part in this larger than life format of the Snowy Day at one of Dutchess County's great parks, Bowdoin Park in the town of Poughkeepsie. Now, I know that you like karaoke as much as I like karaoke, so the Office for the Aging is putting together on December 15th a karaoke, free karaoke, at Bowdoin Park. You can register by calling 486-2555, 1 p.m. at Bowdoin Park on the 15th of December. Another great activity organized by the Office for the Aging. Thanks to Todd Tancredi and the staff. They are very grateful. Okay, how far back do they look at close contacts? Do I have that on a sheet of paper? I do know it generally. I want to make sure I got it right. No, the backwards look is 2 days prior to a positive test and 2 days prior to symptoms. No? They generally look back. I want to make sure that I get it right. But generally speaking, if you test... Here it is, yep. So if you test positive, so again, close contacts, we're within 6 feet for more than 10 minutes over a 24-hour period, you are deemed contagious. That period begins 2 days before symptoms or 2 days before the positive test if there are no symptoms, and they will go back likely 3 days. So for instance, if I tested positive today, Wednesday, they would likely ask you from Sunday forward who may have come into close contact with you or me in this particular analogy. So 2 days, 2 full days. So Tuesday, Monday, they'll say on Sunday forward, give us those names and we'll try to make those contacts. So that is, again, 2 days prior to test, 2 days prior to test, 2 days prior to symptoms. Kimberly, is the county receiving money for PPE from FEMA? Those are good questions. The money is available. Counties have not yet received it. So PPE purchases, so we did a several $million purchase earlier in the year. FEMA has not released those dollars, which is not unusual. Generally speaking, FEMA reimbursement comes at the close of a designated emergency, and that has continued still today. So we should qualify for as much as 90% FEMA reimbursement for those purchases. We're still arguing and advocating for federal aid for loss of revenue and other COVID-related expenses, but those things that are specific to FEMA response, we are to receive as much as 90% FEMA assistance, but we're not likely to see that until the close of the emergency, which is not unusual, but nevertheless, that is what is expected. Kate, has unemployment been extended beyond January 1? Great question. That does come to a close. The COVID-related unemployment benefit comes to a close at the end of the year. Congress is debating that right now. If you followed any of the national news, and I can understand why you may not want to follow any of the national news, the House of Representatives, the Senate, and the White House are currently negotiating a COVID relief package. I think based on our conversations, and we've been advocating directly with members of the House and Senate in this state and in others, we believe we're on the verge of some arrangement. It does seem likely that unemployment benefits will extend into the new year. That does seem to have universal support. There's still a debate over a small business assistance or business assistance, state and local aid, state and local being critical for us to continue to function, and other issues, including indemnification of employers. Those are still being debated, but it does seem like we're on the verge of a deal. The House of Representatives has a bill. With all due respect to my colleagues in the Senate majority has been slow, and the U.S. Senate majority has been slow to come to the table. They are negotiating, and the White House yesterday did come forward with at least a commitment that the House and White House are speaking about the same dollar amount. Now, the details still have to be worked out, but they're talking about a $900 billion federal relief package, and it does seem likely that it is going to move forward. I do want to acknowledge that our delegation, Republicans and Democrats across the state, House and Senate, have been working collectively and collaboratively to meet that particular demand and goal. Jennifer, why did you approve tax breaks for Amazon? Well, I don't approve tax breaks for Amazon. That's number one. I don't actually have any oversight nor approval of any tax breaks. But what Jennifer, what you're talking about, I assume, is the pilot agreement that is being and was considered by the Industrial Development Agency, which is independent. It's independent public authority that does have authority under state law to provide tax abatement. I will say this. First of all, there are dozens upon dozens of businesses, small and large, in Dutchess County who qualify for an abatement. I do support the abatement in this particular case. Taking the IBM campus, which has been so very difficult to redevelop, and finally getting life back to it is critically important. Now, one of the challenges we've had in Dutchess County is because a lot of our economic development locations, these large-scale locations, are former IBM plants. You're not getting folks just to walk in to convert them. They have massive amounts of redevelopment costs associated with them. Yes, Amazon is a very successful corporation, no question. There is, however, a challenge to get this particular site redeveloped, and it's not new. We've been at this for 40 years now, 40, 80, yeah, almost 40 years. Well, I should say 30 years we've been at it, trying to redevelop the IBM location. Secondly, an abatement, while is a deferral of new taxes paid, they are still paying taxes. So I used to say this when I was mayor of Tivoli. I would take a tax abatement any day of the week because it guaranteed me consistent tax revenue one year after another. So this is an abatement that takes them from $150,000 to, I think, $1.5 million over a 10-year period. I think I'll confirm that if I got it. If I have it wrong, that would grow their tax payments from, again, $150,000 to $1.5 million over a 10-year period. And then, of course, as they make those investments, that location assessment will rise, and there will be reconsideration of their condition at the end of that 10-year agreement. Now, the abatement is entirely performance tested. So if they don't perform the 500 jobs, if they don't come forward with the investment, they don't get the abatement. Deal's off. That's the way in which our particular IDA operates. There are clawback provisions. So if there is any lack of attending to those specific expectations, the job creation, they do not benefit from the abatement. So what I would offer to you is that it is a tool that the IDA uses to make properties in New York State a bit more attractive. Yes, Amazon is a very successful financially business. This is not a major job creator. I'll say that out loud, although I admit 500 jobs is absolutely of benefit to our region. But when you look at what IBM employs today, thousands, Global Foundry, thousands, Nuvance, our hospital system, Central Hudson, thousands. So I'll correct myself. It is a large employer, but 500 is another growth area that helps to diversify our workforce. We don't want what we once had, which was all of our eggs in one basket. So that's how that system works. And the IDA does act independently of county influence, so they function based on the specifics of any particular arrangement. And there are, as I said, dozens of businesses that qualify for IDA abatement. And the IDA manages those. So thanks for those questions. If there aren't other questions, I want to remind you again that we're going to come back to you next week, same bat time, same bat channel. Next Wednesday at 3 p.m. Our goal is to keep you updated. If there's anything new in the meantime, we'll let you know. But in the meantime, stay safe, stay healthy, and be kind to each other.